And then next we have your xanthochromia. Xanthochromia class, it is actually a term that we use to describe a CSF supernatant that is color pink. Okay, pwede ding orange or yellow, or yung iba, meron ding mga brown. Okay? Now, a variety of factors that can cause the appearance of xanthochromic sample, with the most common being the presence of RBC degradation products. Okay, so actually, it is caused pala by this RBC degradation products. By the way, class, a brown CSF sample, yung xanthochromic brown sample nating class, it is an indicative of meningeal metastatic melanoma. Okay? Again, meningeal. Okay? Meningeal. Okay? Bahala kayo dyan. Okay? Metastatic melanoma. Now, depending on the amount of the blood and the length of time it has been present, the color will vary from pink to orange to yellow. Now, each of which may kanya-kanyang explanation yan. A pink sample or pink xanthochromic sample, it is due to a very slight amount of oxyhemoglobin. Okay? I'm talking about kapag nag-breakdown na yung ating RBC. Now, an orange sample naman, orange xanthochromic sample is an indication of heavy hemolysis. And then a yellow sample, yellow xanthochromic sample is an indication or due to conversion of oxyhemoglobin to unconjugated bilirubin. Now, other causes of xanthochromia includes elevated serum bilirubin due to the increased serum bilirubin, the presence of the pigment carotene also, markedly increased protein concentrations, and even melanin pigment kapag merong melanoma yung patient. Now, xanthochromia, take note class that xanthochromia that is caused by bilirubin due to immature liver function is also commonly seen in infants, particularly in those who are premature. Again, uulitin ko, yung mga xanthochromia natin that is caused by bilirubin due to immature liver function is also commonly seen among newborn patients or mga infant. Okay, particularly yung mga premature infants natin. And then next we have viscosity. Okay, viscosity. Now, a viscous CSF sample class may be encountered in patients with metastatic mucin producing adenocarcinomas. Again, ulitin ko, a viscous CSF sample may be encountered in patients with metastatic mucin-producing adenocarcinomas. Or pwede din, makikita niyo yan sa mga patients with cryptococcal meningitis. Cryptococcal meningitis. Now, these are the pathological causes of a viscous CSF sample. Okay? Okay, ayun lang pala. Okay, and then next we have your oily CSF sample. Now, an oily CSF sample class, isa lang ang indication yan. The presence of radiographic contrast media. Okay, radiographic contrast media. And then next, we have clot formation. Now, clot formation class may be present in patients with traumatic tap owing to the introduction of plasma fibrinogen into the specimen. Ito yung sinasabi ko kanina. However, we have several conditions involving the CNS that may cause clot formation. And then, each of which may iba't ibang uri ng, or rather, may iba't ibang types ng clot na may encounter natin. So, CSF sample. Now, we have here a clot formation plus the presence of blood. Ang indication lang yan is due to traumatic tap. Okay, it is mainly due to traumatic tap only. And then, we also have clot formation without the presence of blood. Ang indication nito, class, it is highly suggestive of meningitis. And what meningitis, and then we have this what we call condition, your Freund's syndrome. Freund syndrome. Freund syndrome, class, it is actually a condition wherein there is a complete spinal block. Okay? And then we have pellicle formation. Pellicle clot formation. Itong pellicle formation naman na ito, class, okay, it is highly suggestive of suppurative meningitis or TB meningitis. Okay? Now, take note, class, that this type of clot formation, it is not seen in patients with subarachnoid hemorrhage. Again, saan makikita to? Sa mga patients with suppurative meningitis and TB meningitis. Okay, again, what do we call this type of TB? Kapag TB, sorry, what do we call this type of TB na involving the CNS already? We call it the POTS syndrome. Okay, POT, P-O-T, I think double T ata yun, POTS syndrome. Okay, and then lastly, we have your web-like. Okay, tanggalin ko lang to. We have your web-like clot formation, or sometimes pine tree clot formation without the presence of blood. Ang indication lang yan, class, again, TB meningitis. However, this type of clot, class, yung pellicle clot na yan, it may be only observed after refrigeration of your sample for 12 to 24 hours. Okay, again, itong uri ng clot na ito, makikita lang yan after refrigeration of sample for 12 to 24 hours. Now, it is important that this clot may not interfere with cell count. Okay? So, dapat upon microscopic, let's say macro or microscopic examination, ma-distinguish natin agad na clot yan. Kasi it may interfere with the cell count accuracy. Okay? Ay, sorry. Sorry, class. Okay. Ayusin natin malabo. Now, let us move on with the cell counts. Okay? Pag nagpo-perform tayo ng cell count, class, usually we perform WBC as well as RBC count and even total cell count. Okay? Nagpo-perform din tayo ng differential count. Okay? Now, before we perform these cell counts, WBC count dilution, okay, yung mga dilution na ginagawa natin, it is necessary before performing WBC count. Okay, especially if the specimen is turbid or sometimes cloudy or even bloody sample. Okay, so later on in the future, pag mga medtech na kayo, pag may encounter kayo ganitong uri ng CSF, let's say medyo cloudy ang mga yan or turbid or even bloody specimen, kailangan natin mag-perform ng dilution. Okay? Now, if your sample is slightly hazy, okay, a 1:10 dilution is required. Okay? And then, kapag medyo hazy yan, class, okay, 1:20 dilution. How about if slightly cloudy? Slightly cloudy needs a 1:100 dilution. And then, a slightly bloody sample, it requires 1:200 dilution. And then, kapag heavily cloudy yan, cloudy, bloody, or let's say turbid, sobrang turbid, okay, grabe as in, okay, 1:10,000 dilution. Now, as you see, dilution, it depends on the degree of the turbidity of the sample. Now, let us discuss the WBC count first. Okay? Now, lysis of RBCs muna, class, it must be obtained prior to performing the WBC count on either diluted or undiluted specimen. Okay, now specimens requiring dilution can be diluted in the manner described previously, yung mga diniscuss natin kanina. Now, substituting 3% glacial acetic acid to lyse the RBCs. Okay, now addition class, pwede tayo maglagay ng methylene blue, okay, to the diluting fluid to stain the WBCs. Of course, providing us better differentiation between neutrophils and mononuclear cells. Bakit important ito, class? Bakit kailangan nating ma-distinguish yung ating neutrophil from mononuclear cells? Kasi later on, when we will be going to meningitis, doon natin malalaman ang importance ng mataas na neutrophil or mataas na lymphocyte. Kasi an increased neutrophil, okay, it is an indication of bacterial meningitis. Kapag lymphocytes naman ang mataas, it is usually an indication of viral meningitis. Okay, now ano yung mga normal values natin for the adult? A normal WBC count should be 0 to 5 per microliter sa mga adult. Okay, 0 to 5 microliter. And then for newborn, usually kapag mga less than 1 year old yung mga yan, up to 30 per microliter. Pag mga 1 to 4 years old, usually 0 to 20 per microliter is considered as normal WBC count. And then for 5 years old to puberty age, okay, 0 to 10 per microliter. Now, when performing WBC count class, yung kung ano yung ginagawa natin sa hematology, parang ganun din lang sa CM. Okay, we make use of improved Neubauer counting chamber, and then ganun din yung ginagamit nating mga diluting fluids, and then kung saan tayo magka-count, ganun din lang. Okay, so as in the total cell count sa hematology, WBCs are counted in the 4 corner squares and the center square on both sides. Okay, so ilan totally yan? 5, you count in 5 large squares. Okay. And then, paano yung procedure, class? Sa hemocytometer lang din. And then, the number counted is being multiplied by the dilution factor to obtain the number of WBCs per microliter. Okay, so parang sa hema lang din. Now, if a different number of squares is counted, the standard Neubauer formula should be used to obtain the number of cells per microliter daw. Okay, so for our formula, ganito yung ating formula. Okay, sulat lang natin. Okay, so total microliter ang ating unit. Okay, so number of cells counted times, wait, hindi kasya. Okay. Number of cells counted times the dilution times 1 microliter divided by divided by 1 microliter. So, kung paano mo ma-derive to, class, you just simply multiply 0.1 times 10. Okay, so this would be our formula. Now, calculations are possible to correct, class, for WBCs and protein artificially introduced into the CSF as the result of a traumatic tab. Okay, so ito yung tinatawag nating corrections. Okay, kailan tayo magpo-perform ng ganito? Kapag na-contaminate. Let's say, contaminate during the traumatic tab. Okay, so kapag sobrang taas ng WBCs or even the protein. Tama ba yung sinabi ko? Okay, ulitin natin, class. Calculations, again, calculations are possible to correct for WBCs and protein artificially introduced into the CSF as the result of traumatic tab. Okay, now the determination of the CSF RBC count and the blood RBC and WBC counts is necessary to perform the correction. Again, ano yung kailangan nating, class? Yung CSF RBC count, yung WBC count mismo, and then the RBC count mismo. Sa blood, hindi yung sa CSF. Okay? So, paano yung ating formula here? Okay, so let's say, corrected WBC. Ganito lang yon. Okay. So, WBC added equals yung count ng WBC sa blood times yung RBC count sa CSF, RBC, CSF, divided by yung RBC count sa blood. So, by determining the ratio of the WBCs to RBC in the peripheral blood and comparing this to the ratio with the number of contaminating RBCs, the number of artificially added WBCs can be calculated by using this formula. Okay? So, yun lang, class. Now, let us go over with the differential count. Okay? Let us go over with the differential count. Now, in differential count, class, we use this method, what we call cytocentrifuge. Okay? Cytocentrifuge method. Okay, cytocentrifuge method is actually a rapid method requiring minimal training and allows right staining of air-dried cytospin. Okay, your cytocentrifugation. Cytocentrifugation method. Now, indeed, this is actually the recommended method for differential cell counts in all body fluid. Okay, huwag niyong kakalimutan, it is the recommended method for differential cell counts in all body fluid. Now, identifying the type or types of cells present in the CSF is a valuable diagnostic aid. Okay, kaya tayo nagpo-perform ng differential count kasi for us to determine or for us to help us in the diagnosis. Okay? So, parang yung sinabi ko kanina, yung neutrophil, kapag mataas, bacterial meningitis yan. Or kapag, let's say, lymphocyte or monocytes ang mataas, it is usually indicative of viral meningitis. Okay? Now, the differential count, it should be performed on a stained smear and not from the cells in the counting chamber. Again, ulitin ko, class, the differential count should be performed on a stained smear. So, smear ka magbibilang. Stained with right stain. Okay. And then, you count 100 cells. So, parang sa hematology lang kapag nagdi-diff count tayo. Now, poor visualization of the cells as they appear in the counting chamber has led to the laboratory practice of reporting only the percentage of mononuclear and polynuclear cells present. Okay, now, and this can result in the overlooking of abnormal cells with considerable diagnostic importance. Kaya tawag dito, kaya nagpo-perform tayo, class, ng differential count. Kasi sa Neo-Bower, ang nakikita lang naman natin is the count, yung bilang lang nila, 'di ba? The number of cells. Pero nahihirapan tayong ma-distinguish kung anong uri ng cells yung mga yan. That is why we have to perform differential count. Now, to ensure that the maximum number of cells are available for examination, the specimen should be concentrated. Okay, ito yung sinasabi natin. It should be cytocentrifuge first prior to preparation of the smear. Okay, so kung ano yung nagsettle sa baba, yun yung i-smear natin. Now, for the normal values of CSF differential count, okay, for neonates, okay, so i-list down lang natin. For neonates, usually 0 to 2 months old, okay, ang kanilang normal differential count of lymphocytes, wait lang. Okay, lymphocytes, mga 0 to 2 months old. Okay, ang normal differential count nila is usually 5 to 35%. Okay, approximate lang naman yan, class. Okay, 5 to 35%. And then, for monocyte, it is usually 50 to 90%. So, medyo mas mataas, no? And then, for neutrophils, medyo mas mababa. 0 to 8%. 80%. And then for the adults naman, adults kapag mga more than 18 years old, sabihin natin more than 18 years old, their lymphocytes, normal lymphocytes is approximately 40 to 80%. And then for their monocytes, usually mas mababa na, 4 to 45%. And then for neutrophils, 0 to 6%. Now, let us proceed with the tawag dito, yung mga cells na ma-encounter natin sa CSF. Now, we call this term as pleocytosis. Pleocytosis class meaning an increase in the number of normal cells. Okay, normal cells kasi normally makikita mo rin naman sila sa mga body fluids natin, just like in your CSF. Okay, pleocytosis is the increase in number of normal cells. Okay, so number 1 there we have your lymphocytes and monocytes. Now, an increase in lymphocytes and monocytes is an indication of a viral or tubercular or even fungal or parasitic meningitis. Okay, aside from this one, an increased lymphocytes and monocytes is an indication of multiple sclerosis. And then next we have your neutrophils. An increase in neutrophils is an indication of bacterial meningitis and early stages of viral and tubercular meningitis, as well as fungal or parasitic meningitis. Pero mas helpful siya class when it comes to diagnosing bacterial meningitis. Okay. Aside from this one, an increased neutrophils is indicative also of cerebral hemorrhage. And then next we have your blast cells. Your blast cells class is an indication of an acute leukemia. Okay. And then next we have your eosinophils. An increase in eosinophils, dalawa lang yan. Pwedeng may parasitic or fungal infections. Okay, parasitic and fungal infections. And then next we have your plasma cells. The presence of plasma cells or an increase in plasma cells is an indication of multiple sclerosis as well as lymphocyte reactions. And then next we have your macrophage. Your macrophage class, again, yung parang sinabi ko kanina, okay, is an indication of a previous hemorrhage in the form of erythrophages. Okay, erythrophage. Okay, macrophage with ingested RBC. And then next we have your nucleated RBCs. Isa lang ang indication class kapag nakakita ka ng nucleated RBC. Ibig sabihin, due to bone marrow contamination. Ibig sabihin, traumatic collection. Okay? And then next we have the presence of non-pathologic cells. This includes your ependymal cells, choroidal cells, and spindle-shaped cells. Now, ang indication lang yan is diagnostic procedures. Then lastly, we have your malignant cells. Malignant cells is an indication of metastatic carcinomas, lalo na kapag mga melanoma yung mga yan. And then we have CNS carcinoma also.